Good evening. Thanks for joining us tonight. Hennepin Healthcare nurses and other union members are pushing back against a new health benefit plan.
They're asking the Hennepin County Board to step into the fray, warning that HCMC could see a mass exodus of healthcare workers should the plan pass. This, of course, is not the first time Minnesota nurses have raised concerns about staffing and pay. The vote comes just short of a year after the Minnesota Nurses Association reached a deal with 15 Twin Cities and Twin Ports hospitals, narrowly avoiding a strike.
John Croman joins us to explain what's different this time around. John?
Well, in this case, HCMC is a public hospital, so nurses and other unionized employees by state law can't go on strike. But they can picket and they can raise a fuss, in this case asking the county board to stop the hospital's cost-cutting plans.
And 11D is the approval of the 2024 Hennepin Healthcare System, Inc. financial plan.
The Hennepin County boardroom was packed with people wearing the familiar red T-shirts of the Minnesota Nurses Association, there to put pressure on the board to stop Hennepin Health from cutbacks to hospital employee health benefits.
At this point, the decision to be made is, do you stay at Hennepin or do you leave? And people haven't left yet because they have hope that the county commissioners are going to do the right thing.
Hennepin Health nurses and other hospital employees covered by unions gathered at the government center to say they've lost faith in the leadership of the HCMC because of the proposed cutbacks.
They say we're here for life. They say that, we're a safety net hospital. We take care of the sickest people in the county, people who don't have means. Meanwhile, we're enriching our CEO.
Most health systems, 67% of the healthcare systems in Minnesota are losing money currently. We're no exception to that.
Hennepin Health CEO Jennifer DQ Bellis says the hospital was projecting a $127 million budget gap for 2024. She said the hospital board had to choose between cutting staff or cutting back on benefits.
We know that has an impact to individuals. It has an impact to families. Our commitment is in safe staffing, enough staffing, and adequate staffing. That was a request we had from our teams throughout the year.
Some commissioners say they want more information about the impact on the health system's employees.
But there are some significant concerns that are still outstanding, some of which we saw today. So those will need to be addressed before I personally am ready to vote on this, even on the 12th.
Now, the CEO told us the benefit plan that's being offered is still within the top 25% in this market in terms of what all hospital systems in this area offer their employees. She said that benefit cut would have been even deeper, but the county board had already agreed to plug some more money into the system. Clearly, the unions are not buying it, and they expect some action come December 12th. Chris?
Thanks for breaking it down, John. Appreciate it.